This is Call the Psychiatrist, the show where psychiatrists answer your questions. I'm Dr. David Hanley.
And I'm Dr. Abby Snavely.
On today's episode, we'll be answering a question about TV psychiatrists, and then later Abby will set the record straight on psychotropics and pregnancy.
Say you like me, you better count the ways. Side to side, move your hips.
Okay, before we get started, I have to read a disclaimer. This is a podcast. Just because you're listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and maybe entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified health professional regarding any medical questions or conditions. Do you think that'll do it?
I do.
Will anybody sue us?
Not if they don't listen to it. They're
right? We're talking about TV, so I don't know. We're not going to be making too many life-changing recommendations, I don't think.
Speak for yourself. Time will tell.
Okay. All right. So our first question comes from Ryan from New York.
What's the best pop culture representation of a psychiatrist? Frasier, Bob Newhart, The Sopranos, Mayor of Easttown, Law and Order?
All right, Ryan, that's a great question. Abby, you and I tried to teach a class on this at one time, right? We tried to develop a curriculum.
Did a poster. It was an academic project.
Yeah, we had this idea that there's.
Why you're laughing?
Well, it was a great idea because you could actually teach some elements of therapy by using these really good actors, different scenes and things. So it was a good project.
Totally.
But to get to the question, so there's a couple of things. One, we need to broaden the definition from psychiatrist just to psychotherapist. A lot of like old TV shows, old movies, it would have been assumed it was a psychiatrist. As you get later 20th century, and now currently, it's really more of a mishmash. The only time they say that it's a psychiatrist is usually if they're making a point, like it's a villain or something like that. So for the definition or for our discussion today, we'll just say psychotherapist in general. And then as we talk about them, it's helpful to think of these three main classifications or archetypes that we can put them in. The first one is the comedic role. These are the goofy ones that don't really help, but they don't necessarily hurt. Or if they do help, it may be completely unintentional. So there's a lot of these. Abby, you and I were talking not too long ago about Tina Fey's character in the Unbreakable Kimmy Schmidt.
Yes, I love that one. She is a terrible therapist and psychiatrist. I think she's drunk for most of it. For example, she might actually help Kimmy a little bit. But the part that I liked best about that is that she has this white noise machine, which is the exact same white noise machine that I have and every other psychiatrist or therapist I know has. And so there is some specificity to that I know that there's absurdity as well, but that it felt like there was at least somebody in that writer's room that was very familiar with the world of psychotherapy in a way that spoke to me in more than some of the really like broader strokes of maybe some other characters or setups.
So I think she helped Kimmy, but I can't remember if it was more when she was intoxicated or if when she was in the office. I guess it was more when she was in the office.
It matters. Again, just like for TV, it doesn't matter if you're a social worker or psychologist or a psychiatrist. Drunk, sober, whatever. It's just a plot point.
Did you have any other comedic ones that you like? The caller mentioned Bob Newhart. I really like, Bob Hartley.
That's falls more into appropriate for your age. Uh-huh.
Yeah, thank you. He falls more into the subset of the comedic roles as being a straight man. You also see that with Dr. Marvin, which was Richard Dreyfuss's character in What About Bob? But no, I love Bob Newhart. I was having lunch with a counselor a couple of years ago, and we don't know each other very well. And we were talking about some conflictual thing that I was going to have to encounter. And he was like, well, no, you'll just go in there and do that Bob Newhart thing you do, and I'm sure it'll be fine. They'll find it charming. And I'd never had somebody tell me that before. And I was like,
Were you flattered?
I think it was a backhanded compliment. I don't know. I was like, do I stutter a lot? I definitely do it as a shtick. Like if I've got a bit that I'm doing with somebody and playing the straight man like that, but I didn't know that I did it all the time. So
Which is a good part of any therapy, right? I mean, doing bits is all I meant.
I'm in a bit. Yeah. I didn't mean like, in the room with people.
Okay, my bad.
With friends. I didn't mean like, in the office.
No, there's that one. Or did you ever watch Dr. Katz? Do you know that show?
Oh yeah, the wavy animation. Yeah, it was stand-up comedians just doing their bits too, or their
kind of, but they were in there as patients, right? And comedians, I mean, talk about another stereotype, are famously damaged. And so Dr. Katz was being sort of bumbling and very straight while these comedians came in and talked about all of their messed up stuff.
Yeah.
There's a good one. It's a classic.
So we've talked about the bumbling, the buffoons, the straight man. And there's one other one where it's not even the person playing a psychiatrist, but it's just psychiatrist becomes a shorthand for the fact that the character is weird. And so I think an example I always think of with this one is Tobias Funke on Arrested Development.
Oh, good one. Indeed. But it had nothing to do with psychiatry.
No, he had lost his medical license, but there was something because I kept thinking like, okay, what if the character had not been a psychiatrist other than there was the whole thing with his business card and being an aurapist, but
right. No, then he just would have been a crazy person who was like a never nude. And right, I mean, there was an extra, you're right, there's an extra layer of comedy in that he was supposed to be this smart, learned person who was the craziest person in a group of crazy people.
Yeah, because that's the other trope too. You can use it as a shorthand for a pompous but well-educated or supposedly cultured person. I mean, Frasier is the obvious kind of one for that, but there's a lot that fit in that. I had one other topic that I wanted to bring up just in the comedic roles. I was listening to a podcast the other day, The Illusionist, if you want to know. They were talking about mental health terms that are used in everyday language and whether it's problematic or stigmatizing or whatever. And I immediately thought of Jeffrey Tambor playing a psychiatrist just for one episode of Three's Company.
Okay.
And whenever he heard the word crazy, he would get enraged because it was like, he was trying to defend his patients. I just thought it was interesting because we're talking about that kind of stuff now as far as language.
That it's ableist language.
Yeah. Right? And then this was like from the late 70s or 80s by this time. I thought it was interesting. He was defending it. I mean, the rest of the concept of that show was that Jack thought that he had escaped from an inpatient psychiatric unit. So, I mean, it wasn't that pro.
It wasn't that PC.
Yeah, it wasn't that. But anyway, I just thought of Jeffrey Tambor. Yes, also a psychiatrist.
Well, and I mean, I think I think there is a good conversation to be had around that. And when I was talking, I was like, well, are we not saying crazy on this? Generally, I mean, and what I will sometimes even say in the room is, I mean, I don't like crazy if it's been being used in a derogatory way. But often I think crazy is descriptive. It's just not very specific, right? It's like, well, how crazy? What kind of crazy? Like there's so many kinds of crazy. It doesn't really tell me all that much.
We all got a little touch.
Yeah. Right? Otherwise it'd be so boring.
Yeah, I think you used the word drunk earlier. I was talking over you, but.
Oh, yeah. No, I mean, I'm being a little irreverent. This is my place to be irreverent and offensive, Dave. There's no patience around because this is obviously not a medical relationship with the listener. So I can say whatever I want.
And nobody's going to listen to it anyway.
Fair enough.
All right. So should we move on to the second bucket?
Absolutely.
Okay, so the second one will be the idealized psychiatrist. These are almost magical in how they can help somebody so fast. They're often seen as a savior role, omnipotent. They're one-dimensional, but it's just because they're a narrative device. They really are just helping the protagonist resolve something. They're just Yoda in Star Wars, like the first Star Wars. It's just the wise mentor to allow the protagonist to have some revelation that helps move the plot along. There are some modern attempts where they try to make the character more three-dimensional, showing that they have flaws. There's some negative aspects of their personalities. But, when it's contained by a script, that often comes out in the room with the patient. And so it's not very good examples of good treatment, because then these are boundary crossings, boundary violations. But I think that's the effort at showing depth. So not to get too intro to film or film 101 or something, but when you look at TVs and movies over time, you'll see this shift from the psychiatrist going from the expert godlike character to a fallen angel. It definitely serves as a bit of a social commentary about paternalism or authority. Along this trajectory, though, we have to talk about Ordinary People, won the Academy Award in 1980. We'd gone through kind of a rough patch there, Psychiatrist in film, 60s and 70s. Again, anti-authority. You've got One Flew Over the Cuckoo's Nest. Finally, Ordinary People comes out, and there's this caring, empathic psychiatrist played by Judd Hirsch who actually helps somebody. The therapy is pretty accurate. It's very dramatized and condensed and everything, but
go in the
it's
middle
a
of
good
the
relationship.
night, right?
Yeah. There's some of that happens, but for the most part, it works well. And there's I think there's a lot of good representations. I guess back to Ryan's question, who's the best representation? I think it's when there is a relationship that might actually happen without too many boundary crossings. But again, as I said, that seems to come up a little bit too often. 1999, you've got Dr. Jennifer Melfi in The Sopranos. Again, they explore some. Yeah, I think she was another turning point. I kind of think of Ordinary People, and then I think of Jennifer Melfi as really reopening the doors to this type of storytelling, where they include psychotherapists and psychiatrists. I know she had her own problems. I think they explored her alcoholism. She has romantic feelings for her patient, things like that. But I think for the most part, that's a good representation. Yeah. What about you, though, Abby? In this category of just the decent people, who do you think?
I think Good Will Hunting really stands out to me in terms of both being a savior. They do humanize that Robin Williams character some. He also, alongside his patient, kind of grows. There are definitely, maybe some boundary crossings, like at the end, he leaves a note saying that he had to go see about the girl or whatever. But that there is, I think, a real affection there, and him trying to do his best by his patient and not exploiting their relationship. I think that was nice. I
think that's where the bar is, really.
Yeah.
I think that what determines whether they're good or not is, are you going to exploit the relationship that you have?
Right. Because, even with Dr. Melfi, it's not that therapists never have romantic thoughts about their patients, right? Acting on them is a problem, but thoughts or feelings, having your own struggles, like, thank goodness, doesn't preclude someone from, seeking a career as a mental health professional. I think that is the bar. And maybe in the same way, in a more contemporary way, would be Dr. Sharon on Ted Lasso, that she also is a drinker. They at least hint at a lot, and maybe has her own issues that keeps her closed off. But part of her deal is that she has a very professional stance and keeps her boundaries. And maybe specifically in the case of that show, is kind of, she's not as charmed by Ted, or at least she doesn't fall for Ted's defenses in the same way that everybody else does. And that is part of what makes, I think, her actually therapeutic for him, that he doesn't get to repeat his same pattern with her.
No, she fits the magical model too. I remember in the first episode that she's in, she sees somebody who's been struggling. Everybody's been trying to help this person. In one session, he's completely fine. So right. Again, not always
from the
accurate.
yips, which are famously hard to treat.
Right.
Like, where's Dr. Sharon for, the Olympics, and poor Simone Biles? I love Simone Biles. I'm saying if you could fix that for her in one session, somebody would have done it.
That's true. Bring in Dr. Sharon.
Right. If Dr. Sharon existed, then bring her in. U.S. Gymnastics can pay for that shit if they're not too busy paying for lawsuits.
All right. So besides Dr. Sharon, anybody else you'd want to put up there for Ryan?
Another best? I don't think that this person actually falls into the magical category, but I really, really liked the therapist in Big Little Lies. Robin is the name of the actress, but she is dealing with Nicole Kidman, who is being physically abused and otherwise by the Alexander Skarsgård character, and she's trying to help her with this very dangerous situation. And I think it's a pretty sophisticated demonstration of her dealing with these boundaries. She has them in even for a couples session and kind of how she's taking it in. I think the acting is excellent. And even though it's a very dramatic show, maybe for an exception to what you're talking about, I don't think that, I think a lot of it is more subtle and nobody's acting out. And it makes the tension even higher in a way that I think is maybe idealized, because I just think it's so hard to do, but pretty realistic for what you would hope the most skilled therapist would be able to do.
So I read the book, but I didn't see the show. And I remember there being some observations that she was overly, I don't know what the word they used, overly hostile, overly provocative. I haven't seen it, but is there anything to that?
I'd have to look back. I remember watching it when it came out. So it's been, a few years now, thinking like, wow, this is really good. But in the moment now, I have a hypothesis that maybe because this therapist was not being the idealized person, that I wonder if people thought that it was too provocative.
Oh, because they were so used to it
good
being
therapy does, that
mm-hmm.
being either a villain or all good and only nurturing.
Yeah. Okay.
But I don't know.
And then one you and I have talked about a lot, also probably because of when it came out. I know that In Treatment has been rebooted this year. I have not seen any of the 2021, but the old 2008, 2010.
Yeah.
Yeah. Mm-hmm. The old ones, though, problematic from the psychiatrist standpoint, relationship with patients and things. But in terms of like the content of a session, the mm-hmm. pacing, a little fast, but pretty accurate. If you're just looking to see if you want to get a flavor of it, I think that was not bad. I think there were a lot of scenes in there that would be, with the right context, could even be educational.
Oh, correct. And I think really only the bad behavior in the session only came out, at least in that first season or two, kind of, in the penultimate or finale episodes of the season, that something big had to happen, which unfortunately or fortunately isn't always the case in real therapy. So when they really needed it for kind of a crescendo at the end of the season, maybe Gabriel Byrne acted out more than hopefully someone would. But I agree.
Maybe we should, if anyone would have any interest, I have no idea. Maybe we should be watching the 2021. We could do like a little fan breakdown.
Yeah, we could do that. I'd do that.
All right, I got to put one more plug in, just because he's my guy from childhood, Dr. Sidney Friedman from MASH.
MASH?
Yeah, right. I know it's an old reference. I haven't watched a lot of TV in 10 years, I'm going to be honest, but I try to keep up. This is clearly not keeping up, but he was, Dr. Friedman was definitely magical, very idealized, but he had a little more depth. There were times when he struggled with the horrors of war, relied on his colleagues, outreach people for support. So you got to see some of his humanity that didn't necessarily equate to him necessarily being flawed or acting out or anything. So I always appreciate Sidney. And, if you ever look up TV therapist, he's always on the list. So I'd be remiss not to talk about him.
It's a classic.
Yeah.
Mm-hmm. As a scholar of psychiatrists.
As a scholar of psychiatrists. He was really he was, he's got to be one of the biggest influences on me becoming a psychiatrist, really. Because in the 7th grade, so I was, 12, there was a clear demarcation where I was no longer going to be a veterinarian and I was going to be a psychiatrist. So, and that became that's what I would tell people if they said, what are you going to do? Not a baseball player, not it was just like, oh yeah, I would be a psychiatrist. So I assume Dr. Friedman had something to do with that.
I love it.
All right, so
I don't think I even knew what a psychiatrist was as a kid, except that it was maybe.
Well, if you'd been watching Bob Newhart,
right,
and Three's Company, and Growing Pains, you'd have had at least some kind of archetype for it.
My friend's weird stepdad was a psychiatrist, and that's about all I knew. It's a true story. TV had a big influence on your early life, huh?
Oh, wow. Yeah, that's an understatement. Yeah, I can resolve a lot of conflict in 22 minutes, in just the time frame of a situation comedy without commercials.
Mm-hmm.
Yeah,
Mm-hmm.
I was well trained. Okay, so Ryan, our third bucket. This is the shallowest, I suppose.
Mm-hmm.
These are the severely flawed ones. These are the people who do abuse the relationship they have with their patients. They're often just used as a villain. Sometimes they need to be a psychiatrist to be the villain. Sometimes they just kind of add the label. Again, see above in terms of the commentary on paternalism, authority, things like that. So probably my favorite evil one is Dr. Hannibal Lecter. Because he is, like in the other category, he is magical in his powers of observation, but he's also evil. So that one we get to see both sides of it. And then there's the Batman villain,
Mm-hmm.
the Scarecrow.
Cillian
He's a
Murphy.
psychiatrist. Yep. Yeah. What do you think? Do you have some evil ones you like?
The Scarecrow is the main one I was thinking of. And you're right. I mean, when Hannibal Lecter is, insulting Clarice's shoes, it's like he just knew.
With your good bag and your cheap shoes.
He goes straight for the jugular, right? I mean, like it's not.
And he does their accent. And,
yeah.
He can. He's also the trope of being the overeducated, sophisticate, who can tell a good bag through all that plexiglass,
right? And know, what kind of wine goes with your fava beans and whatnot.
Right.
Not like the rest of them.
Yeah. And we've just scratched the surface. I mean, there are so many. I would love to hear if there was any listeners that had their favorites or the worst to let us know, or if they have questions or anything. I would love to get more feedback from people just to see what other folks are watching and what they like.
Yeah.
So one thing that I've noticed when I was trying to catch up on 10 years, there's a lot more shows where there is some kind of mental health professional. And I'm wondering, do you think that's because mental health treatment overall has become less stigmatized?
Yeah, I think so. Definitely, I think more people are talking about it, but I also wonder, about the utility of using the psychiatrist as a place where, the patient or the character goes in and gives a monologue about their interior thoughts in a way that's like less contrived than a voiceover or something, right? That you're getting some sort of thing.
Yeah, that's more my opinion. I actually wonder if it's just more of a cheap device for character development. And now we've become so used to it that we're okay with it being done that way. Sometimes I don't know that it's necessary. So I don't know. I had read some critics that were saying that they thought that it was a reflection of society now as opposed to, something else.
But they don't always seem very, very therapist-y, right? Necessarily. Sometimes it is literally just another person who's listening.
Yeah, they're completely flat. Yeah, they have nothing. They're really doing nothing. They're not even helping the protagonist. They're just simply being a tool in the narrative.
Right. Yeah, I mean, I think that makes sense. But I also think that it is true that the stigma is somewhat reduced about seeing a psychiatrist or seeing a therapist. I don't know that means that the stigma is reduced about having certain diagnoses, maybe not as much taking medication or certain kinds of medication, right? I mean, I think that there's a lot that remains stigmatized, but the idea of talking to somebody, I think, is more widely accepted, though maybe that's not what's happening on television.
All right. I think that's a good place to stop. Ryan, I hope we answered your question. We really appreciate you taking the time to leave a voicemail. We're going to take a short break, and when we get back, Abby is going to talk about pregnancy and psychiatric medication. If you or a loved one are having thoughts of suicide, please call the National Suicide Prevention Lifeline at 1-800-273-TALK. You can also chat with someone online at their website, suicidepreventionlifeline.org. Okay, we are back. Abby, you have some expertise in reproductive psychiatry, and you're going to address a question that you often get when someone's pregnant.
Yeah, Dave, I want to talk about the question of if a woman should or can continue her psychiatric medications during pregnancy. Best case scenario, someone comes in or I get a call with that question. Unfortunately, a more common scenario is that a person has been told by another provider, the internet, their loved ones, that they should not take their medications and they have gone off of them. So I want to talk about a few reasons why I think we have a bias against medicating women during pregnancy. And then I want to talk about the ways that I think about helping someone answer that question of if they want to or ought to continue their meds during pregnancy. I will also make a caveat that I'm going to talk about pregnant women, recognizing that there are also pregnant people that do not identify as women, but someone who is carrying a fetus or potentially becoming pregnant. Sound good?
Fair enough.
Fair enough. Okay. So I think that there is this kind of societal expectation, romanticization, idealization of pregnant people, pregnant women, as well as motherhood. I think there is a real desire to think that pregnant women do not suffer from mental illness, that being a mother is the most important role that a person could take, which means always putting their children first. And often that can mean that, any risk to a fetus should be avoided at all cost, and that the well-being or health of the fetus or potential baby is more important than the well-being of the mother. And I will talk about in a minute how I think that's a false dichotomy. But, the truth is that we would really like women to go through pregnancy completely healthy and vibrant and unmedicated, and then give birth and then be sort of, bathed in light while they are, nursing their beautiful infant in some sort of Madonna child picture. I'm not kidding. Right. And so,
Yeah, no,
okay.
I'm with you.
Yeah.
That's how I like it. That's how I like to visualize it.
That's how you like it. I mean, and so audience note, this is how the men like it. Dave Hanley will speak for all men. This is how he likes it.
There's this one resource online that says, while pregnancy has traditionally been considered a time of emotional well-being, yeah, it's exactly like what you're saying. The default is everything is great.
Right. Considered by whom? Right? Did they interview any people who've ever been pregnant? Like, that makes no sense. Right? Yeah. I mean, I was taught in residency that pregnancy was protective, that people don't actually tend to have mental illness or mental illness symptoms during their pregnancy. There is some evidence, as a side note, that pregnancy is protective against suicide, but it is not a protection against other symptoms. So yes, not true. Data bears that out. People's real lived experience bears that out. And as it turns out, doctors, providers are people too. So I have seen this type of advice coming from primary care doctors, OBGYNs, psychiatrists, usually older male psychiatrists, no offense to anyone out there, or podcast co-hosts, whatever you're but that people don't want to mess with that, right? That there's a bias, and there are some real decisions to be made that maybe people don't feel equipped to make, but if those providers or doctors are not watching out for their own biases and their own cultural influences, instead of looking at the scientific data, then they're going to be in trouble. The other thing I guess I want to point out, which should be no surprise to anyone paying attention to the news, that in this country in particular, people love to tell women what to do with their bodies, what to do with their reproductive organs, what to do around pregnancy. And I think that, taking psychiatric medications in pregnancy is no exception to this, and that a woman or the loved one of someone who is pregnant going online to try to get information about their what they ought to do with their medications in pregnancy is going to be met with a whole variety of very strong opinions about what someone ought to do or ought not to do, when really it's going to come down, no surprise, to a woman's individual situation.
Do you think, though, there's a lot more fear? I mean, we were talking about the idealized state of pregnancy and the protection and all the glowing
Yes.
light, but I also think there's just a lot of anxiety. Can you be around hair chemicals, and can you be in a hot tub, and
Hmm.
can I have artificial sweeteners? And I mean, it seems like the medication question just is dovetails with all of that.
Yeah, I agree. That I think that there's a lot of fear. I think that there is a lot of pressure on people, and maybe more pressure on a certain demographic of women to have a perfect pregnancy. Of course, everyone wants the best for their children. And so, like, I'm not trying to say that anyone has bad intentions here, necessarily, but that, you want to do what's best for your child. And the idea that no one would want to expose their baby to anything potentially harmful is completely understandable. But I think that if we look a little bit closer at this idea, it gets more complicated and more nuanced. So someone could say, well, I don't want to take my psychiatric medication because I don't want to expose my baby to that, right? Well, that's not the actual choice that someone's facing. The actual calculus has to do with weighing the exposure of a medication versus the exposure of an untreated mental illness. And so, recognizing that it's not just the things that we're ingesting or the medicines that we're taking that might have an impact on the fetus, but that you know, not just psychological and kind of self care things that can come with a poorer mental health picture, but also that there are physiologic things happening, that can neurochemically affect a baby, can even affect placental blood flow in some cases, things like that, that there are exposures on both sides, and that we, I think, as a profession, or hopefully as a society, can get over the idea that there is no such thing as no exposure. And then, I think the other part that happens even with doctors when they are trying to determine what the risks are of exposure to certain medications, let's say, there used to be this FDA lettering system that's now out of date that aimed to give doctors or healthcare providers a really easy way of knowing the exposure. Again, all of those all of those determinations of risks only looked at fetal health, which again, I think is a big problem, especially in this country, of putting the well being of the fetus always above the well being of the mother, as if those are even separable, first of all. But also that the different types of exposure are the same. With some medications, the dose and duration can influence the level of risk to the fetus. But also, you have to pay attention to at what point in the pregnancy the fetus is being exposed to these medications, right? In the first trimester is when the body and the organs of the baby are being formed. And so that would, a first trimester exposure, you would be looking for malformations, right? Whereas a third trimester exposure has more to do with brain development. So, again, I guess my point is just that a patient who is pregnant or wants to become pregnant needs to be able to have a very detailed, nuanced conversation with her doctor that hopefully is more scientifically based and as free from social and cultural and internet pressures as there can be. That's a general soapbox.
Right. It's a complicated decision, and there shouldn't be a foregone conclusion. And talk to your doctor and make sure that you're getting good information. Speaking of that, where do you refer patients for good information if when they're starting to have this conversation or when they just want to read a bit more?
My favorite resource is womensmentalhealth.org. It is a website run by obstetricians as well as psychiatrists at Harvard. And what they will do is they write articles about a whole variety of subjects, and it's across the lifespan. It's pregnancy and postpartum, PMDD, menopause, birth control, kind of all this stuff. They will write opinion pieces, it is very detailed and referenced information, but it's also, I think, accessible to most people. You don't have to have a medical degree to understand it. The other thing that I like about it is that, for example, if the New York Times comes out with some editorial that says women should not take antidepressants during pregnancy, as they did a few years ago, basically the same day, the editors of this website will come out with their reaction to these things in the media and go line by line or point by point and say what they agree with or don't agree with. If new information comes out in the form of a study, they will summarize it and then also say, like, bottom line, does this change what we recommend or not?
Wow, that's incredible. I wish we had those resources for like the political news and other things.
Wouldn't that be nice?
Bombarded with, yeah.
Yeah.
Hey, do you remember we had an attending who used to have pregnant people sign an informed consent for their medications, but he never asked anybody else to do that. Only the pregnant ones. Do you recall that? Or do you have a reaction to that?
I don't remember that.
Okay.
I don't.
Do you think that's a good idea? I think informed consents are really good because it makes everybody accountable and I think more mindful of the discussion. I just thought that was interesting that, I don't know, that somehow pregnant people were more litigious, or I don't know why he did that.
Well, right. And maybe that that pregnant people cannot be trusted to, I'm really big on this, right? But to make these decisions for themselves. I mean, I think if we are doing informed consents, they should be good enough for all situations. And I also think that does send, maybe it's not distrust, but I think it sends a weird message that if I am just as supportive of my patient taking the medication she needs during pregnancy as I am somebody else when they're not pregnant, like, if it's the same thing, why would they have to sign?
Mm-hmm.
Like, I think it sends a message that it's more risky in some way. And the doctor might be thinking it's more risky in terms of a lawsuit, but I think it maybe sends a message to the patient that it's more risky in terms of health outcomes.
Mm-hmm. I think it's exactly what you were saying earlier, that it's actually just more complicated than with a non-pregnant person because of, as you're saying, it actually depends on when you're trying to weigh the risk versus the benefits and you're looking at the point of gestation and everything changes, I guess. Like it's a bit of a moving target and it requires a conversation and not just a quick one-off. I don't know. I feel like I have to have the conversation with people that there are, like with anything, there are unknown risks. I mean, there's risks that we know, but you're also taking unknown risks.
Fair.
And I guess, I don't know, there is something about that state of pregnancy that I guess I always want to make sure that the person hears or understands fully.
I think I hear what you're saying, and I think it's important. I think, though, that it makes sense if there is maybe, you're right, that there are I hear the unknown risks part, but in terms of the known risks, there are a handful of medications that have a specific risk, right? Yes. That we might still say is worth it.
Yeah.
I go through it with, I mean, I guess the thing that I will do differently, the other thing I will say, is that I might give people handouts. Micromedex will give you kind of a summary on all the studies that have been done, because also the part of the problem maybe that you're pointing out is that it's actually very hard to study medications in pregnancy. You can't just be like, okay, you group of pregnant people, take this med and we're going to see if it messes up your baby. And then you other people don't, and let's see what happens, right? Like there's not a good control group for this, because usually the people that are going to elect to take the medicine also have worse psychiatric illness or more significant psychiatric illness. So you cannot study these things. So I guess most of it's not known.
Right. I think that's the unnerving part. But I also think the indication is so important. I mean, I've treated some severely mentally ill pregnant people in the hospital, and we've been talking about risk, but we have to also then think about the benefit. And so to those people, the benefit is the difference in, very significant in order to function, just to be able to get through the next hour. And so the decision-making becomes easier because the benefit is so great. Mm-hmm. But I also get consulted on people where, the benefit is a bit murky. if the diagnosis is less severe, or there's alternatives that haven't been discussed with a person, or they don't even know that there's alternatives, that an anxiety disorder could also be treated by cognitive behavioral therapy, and that has not been something that they've been offered, or maybe they don't have access to. Again, just looking at the scale, benefit versus risk, it's a moving target.
No, I think that's right. I mean, and there are, joint American College of Obstetrics and Gynecology, along with the American Board of Psychiatry and Neurology, have joint guidelines about when medication is indicated, including severe mental illness, suicidality, severe symptoms, also lack of stability, or I guess stability for less than 6 months, at least as times to maybe more seriously consider recommending the medication. And so, yeah, I mean, I think you're right, and that you're right. It's not just the risks on both sides. I think it's the benefits on both sides. Though for some of these medicines, right, we have, particularly maybe antidepressants, we have had for decades now, with thousands and thousands of women having taken them. And maybe, there's some risk that's unforeseen, but even as the studies get better, it tends to, not always, it tends to reveal that the risks are even less significant than we thought. And then there's some people that just come in and they're like, you're going to pry this medicine from my cold, dead hands. I mean, I think that's the other part that it comes down to. Or you can say to somebody, you've been hospitalized a dozen times. Every time you've been off your meds, do you really want to risk that now? And they're like, I absolutely won't take anything when I'm pregnant. And, you have to figure out what to do with that too.
Yeah. And I think in those cases, again, the benefits become more clear. There's a lot of people who aren't pregnant that it's not always clear that their medication's beneficial.
Oh, absolutely. Yeah. Well, and then that's the other thing, is that ideally for anybody with a uterus, I'm talking to them not because just they're baby making machines, but that we are talking about the reproductive life cycle. And so sometimes, I'll be like, just so you know, if you get pregnant, it's probably safe, or at least you should continue taking the medicine and call me immediately. And they'll be like, I have no plans to get pregnant. And it's like, great, that's fine. But like, just in case, I'm going to bring this up.
Yeah.
And that I think that you need to be, it's helpful to be having these conversations way before somebody's at this crisis point.
Right. Do you have any other points in your outline?
I think that those are my big kind of like overview main points. Of course, the listener or listeners out there, if they have specific questions, they should call in, and I can talk for a day about any subset of these points. But no, the take home is that everybody should be talking about this all the time. And that, sometimes pregnancy sucks and sometimes it's beautiful and you're a Madonna.
Right. All right. Well, that's going to do it for this episode. We really appreciate you listening. We want to hear from you, so give us your feedback and send in those questions. You can email us a voice memo or just send a regular old email at callthepsychiatrists@gmail.com. You can call and leave us a voicemail at 760-779-2477. That's 760-PSYCH-77. And we're going to have a Facebook group, so we hope that you can join us there to interact and ask your questions. We would really like for you to subscribe or follow the podcast in whatever app you use to listen to podcasts. And really importantly would just be to tell a friend about the show if you think they might enjoy it or get something out of it. And finally, leave us a rating or review so others can find the show. So let's talk soon. Take care.
There's just nothing to follow that up with, right? I'm not put off at all. I love it. I'm just like, your formative parenting happened on the TV screen. Like, I get it. This explains a lot.
Oh, yeah. Yeah, yeah. So, but I mean, but it's irrelevant. But I can't think of Dr. Ruth without thinking about the fear of having an orgasm in the car.
I learned about lesbians from Phil Donahue.
I think I saw it.
The literal theme of the show was lesbians. It was just their existence that was being displayed as the curiosity. The specific human curiosity on display was gay women. That's it.
So I remember a Donahue show that was all devoted to the G spot.